gonna go ahead and do your EKG today. First, I'm gonna put these little electrodes on. They're just little micros. I'm gonna have you lift your shirt up to above your chest. There you go. We're gonna just put these on here. It is a 10 lead, but we're gonna have, or 12 lead, but we're gonna put 10 little stickers on. Yeah. Okay. Once I get these all on, I want you just to relax, stay still. Good thing about this is you don't have to do anything. How high are your socks? Can I pull up the legs of your pants? Okay, perfect. This one too. There we go. And there.
Good morning. So starting this video off this morning with a little trip to the hospital here in North Carolina. Nothing's wrong. Just getting a test done. Doctor put me in like 6 months ago to get an EKG, and I kind of forgot to have it done. So we're here. We're going to run in this morning. I will try to film what I can if they'll let me, but it may just be short clips or whatever, but come along with me and let's see how an EKG is going to go.
What's your last name?
Strickland.
First name?
Joshua.
And birthday. Alright, let me see if Kardia has time.
Okay, all right, we're gonna go ahead and do your EKG today. First, I'm gonna put these little electrodes on. They're just little micros. I'm gonna have you lift your shirt up to above your chest. There you go. We're gonna just put these on here. It is a 10 lead, but we're gonna have, or 12 lead, but we're gonna put 10 little stickers on. Yeah. Okay. Once I get these all on, I want you just to relax, stay still. Good thing about this is you don't have to do anything. How high are your socks? Can I pull up the legs of your pants? Okay, perfect. This one too. There we go. And there. what we'll do is we'll fax this to your doctor. I'm just gonna lay this on your left thigh.
Okay.
Arm. And once I get you all connected up, I'll have you put your arms to your side. Relaxation is the best, that way I don't get interference or disturbances in the leads itself, okay? So go ahead and put your left arm down and your right arm if you want
Oh,
to.
feel like it fell off.
That's okay, don't worry about it, you'll get it. We're long like octopus. Symptomatic right now or anything, are you?
No.
No, just routine, okay.
How accurate are the like your Apple Watches and the Kardia?
Yeah.
I know it's like 1 lead instead of 12, but
Yeah, you know, pretty good. It can detect a murmur that I have, which I thought was kind of weird.
really.
And I wear it to sleep also. That would be something for your son to diagnose or to study is the sleep. You could check your REM cycle with your Apple Watch. So how does it do that? I guess when you don't move at all, that's when you're in that deep REM cycle.
Yeah.
Okay, just look straight ahead. And we're gonna get this in here and just remember to breathe, but don't turn your head. Nice and easy breaths. Keep on running. I'm gonna have to change the electrode on this. For 10 more seconds. All right, we'll take a look. If you need to move, go ahead and move around right now. I'm just gonna take a little look at here. Alrighty. Now these have to be read by a cardiologist. This is a generic output as far as the diagnosis. It's not really a diagnosis, it's kind of an interpretation.
Yeah.
So read it over with your doctor and all that, and that way you'll be able to know exactly how it's read and if there's anything he needs to look at. Okay, give me just a second. I'm going to reprint this. All right, and you are done. See?
All right, got the EKG. So I think instead of waiting on the doctor, we'll take and we'll stick it into ChatGPT and see what ChatGPT says. Now, just talking with the nurse in there that did it, she said there shouldn't be any worries or any concerns like that. So I'm gonna trust her, and we're gonna see what ChatGPT says. Talk to you soon. See you soon. Excuse me. So what the EKG shows from the machine, read and visible tracings. For my rhythm and rate, sinus rhythm, the heart rate was 99 beats per minute, upper end of normal. Okay. With that being said, I've had a couple toothaches, so keep that in mind too, that my blood pressure is reading a little bit higher because of my toothaches. The intervals, PR was 138 ms, which is normal. The QRS, which is the 99 ms, also reads normal. My QTCs was 446 ms, upper normal, borderline, usually not dangerous by itself. Might have to dig into that one a little bit more. The axis was the normal P in the QRS axis. So it says noted some of my abnormal findings, the important part, probable left ventricular hypertrophy, so the LVH. This means that the left side of the heart may be thickened. Common causes would be high blood pressure. I have that going on right now. Athletic conditioning, probably not. And long-standing heart strain. Huh. This is not an emergency, it says, but usually deserves follow-up, often an echocardiogram. We'll ask the doctor about that and see what he says. Borderline T wave abnormalities in inferior leads, number 2, 3, and the AVF. Described as T wave flattening. This can be caused by normal variations, electrolyte imbalance, mild ischemia, ischemia, probably saying that wrong, and the LVH strain pattern. Not diagnostic of a heart attack on its own. Huh. Overall label, abnormal ECG, unconfirmed diagnosis. This is computer generated, not a physician's diagnosis. So I think what this means is we probably need to get with the doctor, see what he says can be done, and go from there. That's pretty much the story of the EKG portion. So there's a larger blow up of the reading, as you can see. So comment below if you actually know how to read these, and let me know what you see. So with that, let's go ahead and let's get a recording of the Apple Watch and the Kardia. So let's move. Okay, so for that, it reads that this ECG does not show signs of atrial fibrillation and 83 beats per minute. So with that being said, we can go to look at our phone real quick, and we'll click on the one that just happened. We'll take a picture of it. That way we can ask ChatGPT to read it as well. Now it just shows pretty much a screenshot portion of this. So let's see. We'll go through here. Screenshot it. Let's pull up ChatGPT. Let's see. Did this one. I'm gonna get set up, be right back. So here we are on ChatGPT again for the Apple Watch, and we're gonna just ask it the same question and see what it says. Read my ECG from the Apple Watch and tell me my results. Helps to spell it correctly. All right, so basically kind of the same thing up front, just letting us know right away that it's just telling us that it can explain the Apple Watch ECG and what it's showing, but it's telling us to keep in mind this is not a medical diagnosis. It's a consumer screening tool and not a full clinical ECG. So the results shown, the sinus rhythm is the average heart rate, 83 beats per minute. So your heart rhythm appears normal. Electrical signals are starting where they should in the sinus node. And the heart rate is within normal resting range, 60 to 100 beats per minute. So about the waveform, you're seeing the tall spikes are QRS complexes with each heartbeat, and the rhythm appears to be regular. The sharp downward dips and slight irregular looking areas are very common artifacts with the Apple Watch ECGs. These are often caused by hand or finger movements, muscle tensions, grip pressure on the crown, electrical interference. And the Apple Watch ECGs frequently show noise that would not appear on a clinical 12-lead ECG. All right, so one of the things that it first tells us. And it also just takes and reminds us that the Apple Watch cannot reliably detect heart attacks, blocked arteries, structural heart disease, and all arrhythmias. So it mainly just screens for the atrial, so AFib, which your watch did not detect here, it says. All right, so feeling pretty good. Now we have one more that we can check for, and that's the Kardia. So let's go ahead and get the Kardia going. We'll come here, we'll go to my health care. We'll screen it. All right, so here we go. Record EKG. Let's see what it says. Okay, the results are in. Normal sinus rhythm, 86 beats per minute to 25 millimeters and a 10 millimeter version. No rhythm abnormalities detected in your EKG. Kardia does not check for heart attacks again. Okay, so basically the same. The lines even look the same, so I'm not going to plug it into ChatGPT this time. We can go from there. I feel good. I'm not having any chest pains, so yeah. All in all, I'm going to get with the doctor, see what he says about the real EKG, and go from there. I'll keep you updated. Anyway, thanks for watching. Thanks for supporting us. Share it, tell your friends, get us to 1,000 subscribers. And with that being said, we appreciate you. See you next time.